So what did we learn then in this symposium? Hopefully from these talks, we've learned that history taking is still a very important facet along with examination of the patient. Knowing what the type of symptoms are, the presence of a prodromal illness, the laterality of involvement, the acute or chronic course of the disease is helpful. And obviously these are posterior uveitis. The vitritis may be variable. White dots or white spots or plaquoid lesions, RPE granularity, presence or an absence of chorioretinal scarring all can help you in this pattern recognition endeavor that we have. But many times we'll see mixed patterns. We may see atypical courses or prolonged or progressive courses, which we may need to consider other diseases that may look like white dot syndromes that are important to rule out, particularly as Dr. Davis and others pointed out, neoplastic masquerades and non-neoplastic masquerades should be ruled out. At least you should rule out the usual suspects, sarcoid, syphilis, TB, as we do in all uveitis cases. But we should rule out particularly infectious uveitis, for example, TB in the case of tuberculous multifocal serpiginoid choroiditis, and of course neoplastic masquerades that can sometimes look like birdshot, as Dr. Davis pointed out in one of her cases. If you're still not sure after examining the patient and doing a thorough fundus exam, use these other modalities. The ultra-wide field imaging systems using fluorescein angiography, ICG, can be very helpful, along with spectral domain OCT, fundus autofluorescence, and if you have the availability, OCT angiography that can delineate the pathophysiology of these diseases. The therapy, as Dr. Jabs just eloquently described to you, involve many times observation only versus those more severe cases of birdshot and serpiginous, of course, will require immunomodulatory therapy for long-term control. And of course, treating complications of disease such as choroidal neovascularization with anti-VEGF therapy goes without saying. I wanted to thank all of our esteemed speakers and the audience for your participation and hope you learned something about white dots today.